The purpose of Mission Zero is to make sure that no one's left behind.
Mission Zero is a very important because there's a lot of people here. They need to be tested for these viral diseases like HIV, hepatitis and TB.
So the main aims of Mission Zero is working towards reducing new diagnosis of HIV, hepatitis and TB by 2030, and also working around equality, access to treatment and reducing stigma.
Another aim is to stop preventable deaths by 2030.
So Mission Zero as well is a real opportunity for partnership work with the Brunswick Centre, Hepatitis Trust, the TB Calderdale and Huddersfield Trust, bringing us all together to work for the common good of Calderdale.
It's good to come together with one major goal, and that's helping to combat TB, HIV and viral hepatitis. So the taboos around hepatitis C is that it's a drug-using disease. Some people feel that they are marginalised within society, especially if they're injecting drug users.
There's still a lot of stigma around HIV, and at the Brunswick Centre we are working really hard, as well as other organisations, to try and reduce this stigma.
Especially in the South Asian communities, there's a lot of stigma. The people don't come forward for testing, and that's why we are going into their communities, into mosques, into mandirs, into gurdwaras, to test them and offer them treatment. People
are quite ignorant about, can you still catch it? Some people think you can still catch it from a toilet seat, from sharing a glass, which is so untrue. It's actually not that easy to contract HIV. It's really important to get tested and for people to know the status. If people know the status, then they can take control of their own health. With the HIV test, it's a finger prick test, and then the results are there in about 5 minutes, so it's quite rapid. With the hepatitis results, you get the results from them in about 10-15 minutes. The TB test is an intravenous blood test, and that has to be sent off to the lab, so people probably have to wait about 10 to 14 days to get the results from that test.
So hepatitis C is a blood-borne virus, and it's transmitted through blood-to-blood contact. If left untreated, it can cause fibrosis, cirrhosis and liver cancer. But now there is a fantastic cure out there for hepatitis C that is curable with antiviral medication.
It's a very effective treatment. It's just 8 to 12 weeks and there's no side effects, so it's a 97% cure rate.
If there's a reactive result for the HIV test, we've got referral pathways in place. People will then get a confirmatory test and there's treatment available. And as long as people adhere to that treatment, then they become undetectable, which means they won't pass it on. I'm very optimistic about Mission Zero. I think it's a really worthwhile project, and I think it can only bring good results for Calderdale and help to reduce new diagnosis.
I'm very proud to be part of the Mission Zero project, being able to reach people with TB, HIV and viral hepatitis and work as one big team with one major goal.
It's a very important initiative for Mission Zero to organise these type of events, because this can be helpful for the communities in the longer run.
I think Mission Zero sends a message to the people of Calderdale as well, that these services, we really care about people in Calderdale and really want to improve health outcomes.